My dear friend, I want you to take a moment right now to relax your shoulders. Drop them away from your ears. Take a deep, slow breath. If you are watching this, chances are you've been living in a state of high alert. Perhaps you woke up this morning with that familiar dull ache at the base of your skull, or maybe you're struggling with a frightening electric sensation that shoots down your arm and makes your fingers feel like they're buzzing with static electricity. As a physician who has spent over 3 decades helping people reclaim their lives from spinal injuries, I want to tell you something very important. Your body is not betraying you. That pain, that tingling, that strange weakness in your hand, it is not an enemy. It is a signal. It is your body's sophisticated way of asking for help. And today, we are going to learn how to listen. Chapter 1. Beyond the neck pain. Understanding the silent signal. In my clinic here in the United States, I see a recurring pattern. A patient comes in deeply distressed, holding an MRI report that mentions C5-C6 disc herniation or foraminal stenosis. They often believe their neck is crumbling. But here's the secret I share with all my patients. We do not treat pictures, we treat people. It is a scientific fact, supported by the American Journal of Neuroradiology, that many people over the age of 40 have disc bulges in their neck and feel absolutely no pain at all. So why do you feel it? The answer lies in a condition called cervical radiculopathy. Think of your cervical spine as the main highway of your nervous system. Your brain sends signals down through this highway to tell your hands to grip a coffee mug, to tell your arms to hug a loved one, and to receive sensations of touch and temperature. A herniated disc occurs when the soft inner center of a spinal disc pushes through a tear in the tougher exterior. When this jelly leaks out, it doesn't just cause a mechanical pinch, it triggers a chemical inflammatory response. In the small, delicate space of your neck, that inflammation short-circuits the nerves. This is why you feel the pain in your hand, even though the problem is in your neck. It's a phenomenon called referred pain. If the C6 nerve root is irritated, you might feel numbness in your thumb. If it's the C7, the tingling might move to your middle finger. I recently saw a patient named David, a software engineer from Seattle, who was convinced he had carpal tunnel syndrome because his wrists ached so badly. He had been wearing wrist splints for months with no relief. When we examined his neck and looked at the way his nerves were being signaled, we realized the kink in the hose was at the level of his neck. Once we addressed the cervical inflammation, his wrist pain vanished. Many of my friends in the medical community rely heavily on surgery as the first option, but I want to offer you a different perspective based on the most recent clinical evidence. The Journal of the American Medical Association, or JAMA, has highlighted that for the vast majority of cervical disc herniations, conservative management is not just an alternative, it is the gold standard. Your body possesses an incredible microscopic army of cells designed to clean up disc material. But this army can only work when the volume of your systemic inflammation is turned down. When you see words on your medical report like stenosis, which simply means narrowing, or osteophytes, bone spurs, please do not let your mind spiral into fear. Fear is a physical stressor that tightens the very muscles we need to relax. In the neck, we have a complex web of muscles, the scalenes, the trapezius, and the deep neck flexors. When fear takes over, these muscles go into a protective spasm, further compressing the discs and choking the nerve roots. My dear friend, our journey toward goodbye back pain, and in this case, goodbye neck pain, starts with understanding the silent signal. Your pain is telling us that the delicate balance of your cervical spine has been disrupted, perhaps by the way we hold our heads while we work, or perhaps by the way we carry the weight of the world on our shoulders. But the most beautiful part of this science is balance can be restored. We are going to move away from the fear model and toward the recovery model. We are going to look at how we can give those nerves more breathing room through postural alignment and biochemical support. You are not a victim of your anatomy. You are a living, breathing ecosystem that is constantly trying to find its way back to equilibrium. In the chapters to come, we will discuss the tech neck epidemic and how the simple force of gravity is playing a trick on your spine. We will explore the Pac-Man cells that are ready to go to work for you, and I will show you exactly how to move to desensitize your nervous system. But for now, I want you to sit with this one thought. Your body has successfully healed 1,000 cuts, bruises, and broken things in your lifetime. Your neck is no different. It has the blueprint for repair. It just needs the right environment to execute the plan. I am so glad you are here with me. You are taking the first, most important step toward recovery, which is education. Knowledge is the ultimate anti-inflammatory for the mind. When you understand the why behind your pain, the how of healing becomes much clearer. If you felt a sense of relief or clarity from this first chapter, please like this video and share it with someone you know who is constantly rubbing their neck or complaining of numb hands. We are building a community of hope and science-backed healing here at Goodbye Back Pain. Subscribe to join us as we move into Chapter 2, where we will uncover the modern traps that are keeping your neck stuck and how to break free once and for all. Stay tall, breathe deeply, and I will see you in the next chapter.
My dear friend, I want you to think about the last time you truly felt light, not just in your spirit, but in your body. For many of us, that feeling of lightness has been replaced by a heavy, gnawing fatigue at the base of our necks, a sensation that we are carrying an invisible heavy yoke throughout the day. In my 3 decades of practice, I have seen a dramatic shift in the types of injuries walking into my clinic. Years ago, neck issues were often the result of sudden trauma, like a car accident or a fall. Today, however, we are facing a quiet, slow-motion epidemic that is affecting millions of Americans, from teenagers to retirees. It is a condition we call tech neck, and it is one of the primary drivers of cervical disc herniation in our modern world. To understand why your neck is struggling, we have to look at a simple law of physics: gravity. Your head is a marvel of biological engineering. In a neutral, upright position, the average adult head weighs about 10 to 12 pounds, roughly the weight of a professional bowling ball. When your ears are aligned perfectly over your shoulders, your cervical spine is designed to distribute that weight effortlessly through its natural C-shaped curve. But the moment we tilt our heads forward to look at a smartphone, a tablet, or a laptop screen, the physics change dramatically. I often share a groundbreaking study with my patients by Dr. Kenneth Hansraj, published in Surgical Technology International. His research demonstrated that as the head tilts forward, the effective weight on your neck increases. At 15 degrees tilt, that 12-pound head now feels like 27 pounds to your spine. At 45 degrees, it's 49 pounds. And at 60 degrees, the typical angle we use when texting or scrolling through social media, your neck is supporting a staggering 60 pounds of pressure. My dear friend, imagine for a moment that you are holding a 60-pound dumbbell. Now imagine trying to hold that weight out in front of you for 5, 6, or 7 hours every single day.
Eventually, your muscles would scream in agony and the joints in your arm would begin to fail. This is exactly what is happening to your cervical discs. They are being crushed under a gravity trap that they were never designed to endure. Let me tell you about a patient of mine named Maria. Maria is a 29-year-old graphic designer from Chicago. She came to me complaining of debilitating migraines and a strange deadness in her right arm. She told me, "Dr. Beth, I feel like my head is too heavy for my body." When we looked at her workstation setup and her daily habits, we realized she was spending nearly 9 hours a day in a forward slumped position. Her C5 through C7 discs were literally being squeezed like a grape between two stones. The jelly inside her discs was being pushed backward right into the sensitive nerve roots that lead to her arms. But tech neck isn't just about the discs, it's about the kinetic chain. When your head moves forward, your shoulders naturally round inward to compensate. This creates a state of upper crossed syndrome. The muscles in the front of your chest, the pectorals, become dangerously tight, while the muscles in the back of your neck and upper shoulders become overstretched and weak. This muscular imbalance creates a constant tug of war on your vertebrae, pulling them out of alignment and making a disc herniation almost inevitable. In the United States, we are a culture of doers. We push through the pain. We reach for another cup of coffee or an extra-strength ibuprofen and keep our heads down. Literally. But every hour you spend in that collapsed posture is a withdrawal from your spinal bank account. Eventually, the account goes into debt, and that debt is paid in the form of a herniated disc. However, I want to offer you a golden rule that I gave Maria, and it changed her life. It is, eye level is buy level. If you want to buy back your health, you must bring your world up to your eyes rather than bringing your eyes down to the world. This means raising your computer monitor so the top third is at eye level. It means holding your phone up in front of your face like you're taking a photo, rather than resting it in your lap. Science tells us that the body is remarkably plastic. It adapts to the demands we place on it. If we demand it to be a C shape hunched over a desk, it will remodel itself into that painful position. But if we demand it to be upright and aligned, it will begin to strengthen the deep neck flexors, the tiny muscles that act like internal guy wires to support your head. Maria started making these small changes. She didn't need a miracle. She needed to escape the gravity trap. Within weeks, her heavy head feeling began to lift. Her migraines dissipated because the suboccipital muscles at the base of her skull finally stopped being crushed. Her body began the beautiful process of neovascularization, bringing blood flow back to those compressed discs to begin repair. My dear friend, you are not a victim of your technology. You are simply a human being living in a digital age who needs to relearn how to stand tall. Your neck is a bridge between your mind and your body, and it deserves to be a strong, stable bridge. In our next chapter, we are going to look at the hidden helpers inside your body, those incredible cells that are waiting for the signal to start cleaning up the mess caused by years of tech neck. We are going to talk about the miracle of microscopic repair, and I promise you, it is one of the most inspiring stories your body has to tell. If you realize today that you've been caught in the gravity trap, don't be discouraged. Recognition is the first step of healing. Please like this video and share it with your friends or coworkers, especially those you see hunched over their desks every day. We are all in this modern world together, and we can all help each other stand a little taller. Subscribe to Goodbye Back Pain so you don't miss Chapter 3, where we dive into the internal surgery your body is already trying to perform. Until then, lift your chin, raise your phone, and remember, you were made to look at the horizon, not at your feet. With warmth and hope. My dear friend, we have spent our first 2 chapters identifying the weight we carry.
both the physical weight of tech neck and the emotional weight of a scary diagnosis. But today, I want to take you deep inside your body to witness a process that is nothing short of a miracle. One of the most common things I hear in my clinic is, "Dr. Beth, if my disc has leaked out, surely it's stuck there forever. It's like toothpaste out of a tube, right?" I want you to erase that image from your mind right now. Your spine is not a mechanical object made of plastic and metal. It is a living, breathing, and highly intelligent ecosystem. Today, we are going to discuss the science of spontaneous resorption, the way your body actually eats a herniated disc. To understand this, let's look at the story of John. John was a 45-year-old high school teacher from Boston. He came to me with a massive herniation at C6, C7. He had lost the strength in his right triceps and couldn't even lift a gallon of milk. His MRI looked like a disaster zone. Most doctors he saw pointed at the screen and said, "We need to cut that out." But John wanted to wait. He wanted to see if his body had a better plan. What John and many of you didn't know is that the human body has a specialized cleanup crew called macrophages. In the world of biology, these are your Pac-Man cells. Their entire job is to identify anything in the body that shouldn't be there, surround it, and digest it. When the jelly, the nucleus pulposus of your cervical disc, leaks out into the spinal canal, it is effectively a stranger in a strange land. It is a foreign protein. The moment it touches the space outside the disc, your immune system sounds a silent alarm. A fascinating study published in the journal Clinical Rehabilitation confirmed that the body has a high rate of spontaneous resorption of cervical disc herniations. In fact, some studies show that up to 75 to 85% of cervical disc herniations can regress or disappear entirely without surgery. Why? Because the neck is a hot zone for healing. Unlike the lower back, which has a more limited blood supply, the cervical spine is surrounded by a rich, dense network of blood vessels. This leads us to a process called neovascularization. When a disc herniates in the neck, those macrophages don't just show up alone. They bring with them the signals to grow tiny new blood vessels into the herniated material. This is crucial. These new vessels bring in oxygen, hydration, and more cleanup cells. They turn that hard, irritating jelly into something soft and eventually into something that the body can simply reabsorb into the bloodstream. I told John, "Your body is already performing an internal surgery. Our job is not to stop it, but to give it the perfect environment to succeed." So, how do we support these internal surgeons? First, we must manage systemic inflammation. If your body is already busy fighting inflammation from a high-sugar diet or chronic stress, which floods your system with cortisol, your macrophages become distracted and sluggish. They can't focus on the spill in your neck because they are busy fighting fires elsewhere. This is why I put John on a high-dose omega-3 regimen and an anti-inflammatory diet to clear the road for his immune system. Second, we must prioritize hydration. Resorption is a fluid-based process. If you are dehydrated, the herniated material becomes hard and calcified, making it much more difficult for your body to break it down. Think of it like trying to wash away dried mud versus fresh, wet mud. Fresh is always easier to move. John followed the roadmap. He improved his posture to take the gravity trap pressure off the disc, he stayed hydrated, and he practiced the gentle movements we will discuss in the next chapter. 4 months later, we did a follow-up MRI. The massive herniation that had once choked his nerve was 70% smaller.
His triceps strength had returned, and the electric pain in his arm was gone. His body had done exactly what it was designed to do. My dear friend, I want you to take a moment to appreciate the wisdom within you. Right now, as you read this, your body is likely sending signals to repair, to clean, and to strengthen. The pain you feel is often just the noise of the construction site. It doesn't mean the building is falling down. It means the workers are on the job. In the United States, we are often taught that we are broken and need fixing from the outside. But real medicine, true healing, starts with supporting the internal genius of the human body. Your cervical spine is not a weak point. It is a resilient structure that is constantly remodeling itself. In our next chapter, we are going to talk about how to pump those nutrients into your neck through strategic mobility. I'm going to show you exactly how to move so you can assist your macrophages and speed up the resorption process. We are going to move from passive waiting to active healing. If John's story gave you a sense of relief today, please like this video. Share it with someone who is currently terrified by their MRI report. Let them know that their internal surgeons are already on the clock. And subscribe to Goodbye Back Pain so you don't miss Chapter 4, where we get your neck moving safely and strategically. You are not alone in this, and your body is more capable than you've ever been told. I'll see you in the next chapter. With warmth and hope.
My dear friend, we have reached a pivotal moment in our roadmap. We've unmasked the tech neck epidemic and marveled at the microscopic Pac-Man cells working tirelessly to clean up your disc. But now we must address the most common mistake I see patients make in their recovery. When the neck hurts and the arm tingles, the natural instinct is to freeze, to stop moving entirely, and perhaps reach for a rigid neck brace. But I want to tell you a truth that is foundational to modern sports medicine. Movement is life, and stagnation is the enemy of healing. In my clinic, I often see patients who had become neck phobic. They turn their entire bodies just to look at someone, keeping their neck as stiff as a board. They believe they are protecting the disc. But as we discussed in our earlier chapters, your discs do not have their own blood supply. They're like sponges that need a gentle pumping action to stay healthy. When you stop moving, you stop the pump. You essentially starve the disc of the nutrients it needs to repair that outer ring and assist the resorption process we talked about in Chapter 3. Today, we transition from passive waiting to strategic mobility. Strategic mobility is not about cracking your neck or forcing yourself into painful stretches. It is about precision. Let me tell you about a patient named Robert, a 52-year-old high school principal. Robert had a C6-C7 herniation that made it impossible for him to turn his head to check his blind spot while driving. He had been told to just rest, but after 3 weeks of rest, he was stiffer than ever. I told Robert, "We aren't going to stretch your neck, we are going to stabilize it first." This is a concept championed by experts like Dr. Stuart McGill. For the cervical spine, we focus on a bottom-up approach. The first exercise I taught Robert, and the one I want you to visualize now, is the cervical chin tuck. This isn't about looking down. It's about gently drawing your chin straight back, as if you're making a double chin, while keeping your eyes on the horizon. This simple movement does 2 incredible things. It creates space in the back of the spinal canal, taking the pressure off the nerve root, and it activates the longus colli, the deep internal core muscles of your neck that act like a supportive corset for your vertebrae.
Scientific research published in the Journal of Orthopedic and Sports Physical Therapy shows that strengthening these deep neck flexors is significantly more effective for long-term recovery than general stretching. When Robert started doing these micro movements throughout the day, especially while sitting at his desk, his body realized it no longer needed to guard the area with painful muscle spasms. The brain received a signal: it is safe to move. Another key part of strategic mobility is the scapular set. Remember how we talked about the kinetic chain? You cannot fix a neck that is sitting on a collapsed foundation. If your shoulders are rounded forward, your neck has no choice but to strain. I had Robert practice gently tucking his shoulder blades into his back pockets. By stabilizing the mid-back, the thoracic spine, the neck is suddenly liberated. It's like clearing the debris off a bridge so the traffic can flow again. The beauty of strategic mobility is that it respects the pain-free zone. In the U.S., we often hear the phrase, "no pain, no gain." In my clinic, we say, "no pain, no gain." We listen to the pain. If a movement causes that electric zing to shoot down your arm, we stop. We're looking for the green light movements, those that feel like a gentle oil for your joints. Robert's recovery wasn't a straight line, but it was a steady one. By moving strategically, he was helping his body pump out the inflammatory waste and pump in the oxygen-rich fluid his macrophages needed to finish the job. Within 6 weeks, he was checking his blind spot with ease. He wasn't just better, he was resilient. My dear friend, I want you to understand that your neck is not a fragile porcelain vase. It is a robust, adaptable structure of bone, muscle, and ligament. When you move with wisdom, you are sending a powerful message to your nervous system that the crisis is over. You are reclaiming your territory from the pain. In our final chapter, we're going to look at the big picture. We'll discuss how to manage the mind-body connection to ensure this recovery is permanent. We'll talk about how stress and your environment play a role in keeping those muscles tight, and how you can build a fortress of health that lasts a lifetime. If the idea of strategic mobility gave you a sense of empowerment today, please like this video. Share it with someone who is currently wearing a neck brace or afraid to move. Let them know that gentle, wise movement is the key to their freedom. And make sure to subscribe to Goodbye Back Pain. Your journey to a pain-free life is moving forward, and I am so proud of the progress you're making just by being here. Take a gentle breath, tuck that chin back just a 1/4 inch, and I'll see you in Chapter 5, with warmth and hope.
My dear friend, we have walked a long and transformative path together. From the initial fear of a slipped disc to the physics of tech neck, and from the biological miracle of resorption to the empowerment of strategic movement. But as we reach this final chapter, I want to share with you the most profound secret to long-term healing, the one that bridges the gap between simply feeling better and staying well for a lifetime. This secret lies in the connection between your mind and your body, a concept we call restoring the flow. In my 30 years as a physician, I have noticed that the patients who recover the fastest aren't always the ones with the smallest herniations on their MRI. They are the ones who learn to master their internal environment. You see, your cervical spine is not just a stack of bones. It is the physical antenna for your nervous system. It carries the weight of your thoughts, your stresses, and your emotions.
let me tell you about Sarah, a 48-year-old nurse from Philadelphia. Sarah had successfully used the movements we discussed in Chapter 4 to resolve her arm pain, but every time she had a particularly stressful week at the hospital, her neck would lock up again. She told me, "Dr. Beth, it feels like I'm back at square one every Monday." What Sarah was experiencing is a phenomenon known as central sensitization. When we are under chronic stress, our bodies enter a state of high alert. Our sympathetic nervous system, the fight or flight response, triggers a constant contraction of the trapezius and levator scapulae. These are the muscles that pull your shoulders toward your ears. When these muscles stay tight, they act like a vice, constantly compressing the cervical discs and reducing the very blood flow that your macrophages need to keep the area clean. I told Sarah, "We have fixed the hardware of your neck, but now we must address the software, your nervous system." The science is clear. Studies in the Journal of Pain Research show that emotional distress and a lack of relaxation can actually amplify the pain signals coming from your spine. To restore the flow, we must learn to signal to our brain that we are safe. For Sarah, this meant incorporating just 5 minutes of diaphragmatic breathing twice a day. When you breathe deeply into your belly, you stimulate the vagus nerve, which acts as a kill switch for the stress response. This immediately lowers the tension in your neck muscles, allowing the discs to decompress naturally. But longevity is also about spinal hygiene. Just as you wouldn't dream of going days without brushing your teeth, you must not go days without brushing your spine. This means making the chin tucks and scapular sets we learned a permanent part of your day, not as a chore, but as a celebration of your mobility. Longevity also means looking at your environment. In the U.S., we are surrounded by convenience that invites us to slouch. Build your fortress of health by investing in your workstation, a chair with proper lumbar support, a monitor at eye level, and, perhaps most importantly, a pillow that maintains the natural C-curve of your neck while you sleep. Your body spends a third of its life sleeping. That is the time when the internal surgeons do their best work. Don't make their job harder with a pillow that kinks your hose. As we close this roadmap, I want you to remember that healing is not a destination, it is a direction. There will be days when you feel a small twinge or a bit of stiffness. When that happens, I don't want you to panic. I want you to smile and say, "Ah, my antenna is giving me a signal." Use it as a reminder to breathe, to move strategically, and to check your posture. My dear friend, you are not a back patient or a neck patient. You are a resilient, capable human being who has regained the knowledge to take care of your most precious asset, your health. You have the tools, you have the science, and most importantly, you have the internal power to heal. It has been my greatest honor to guide you through this journey on Goodbye Back Pain. But my mission is to reach every person who feels stuck or hopeless in their pain. I need your help to turn this ripple of healing into a wave. If this series has given you hope, if it has helped you understand your body better, or if it has helped you avoid an unnecessary surgery, please like this video and share it. Send it to a friend, a family member, or a colleague who is struggling. You might be the reason they finally find relief. And please subscribe to our channel and join our community. Your support allows me to keep bringing these science-backed medical insights to the world for free forever. Let's continue to spread the value of medical wisdom and help millions reclaim their lives. Thank you for being here. Stand tall, breathe deeply, and remember, your journey to a pain-free life is just beginning. With my deepest warmth and unwavering hope, Dr. Elizabeth Reed, Beth.